Hello everyone, my name is Marcio Averbeck. I'm a urologist in Porto Alegre, Brazil, and today I'm at the live lounge at the ICS 2024, in which I have the pleasure to host Dr. Sanjay Sinha from India and Dr. Benoit Peyronnet from France. We'll be discussing some highlights of day 3 of the ICS 2024, which had a very interesting lecture today about bladder outlet obstruction presented by Professor Ferdinand Fusco from Italy, in which he highlighted the need to identify high-risk patients, as some of these patients, particularly those ones with other comorbidities such as metabolic syndrome, a higher obstructive pattern, may develop detrusor undercontractility in the medium to long term. So this is something really trendy nowadays, particular for male LUTs, how to identify high-risk patients. And in these regards, I would like to ask our speakers to introduce themselves and to bring your own ideas about what are the topics that may be of interest for our ICS members worldwide. Thank you for coming.
I'm Dr. Sanjay Sinha. I'm a urologist in Hyderabad in India. I have an academic interest in functional urology. I also happen to be the founding national chair for the functional and female urology section of the Urological Society of India. And I'm really happy to be here today, not just for the ICS conference, but also for this interview and this discussion in the ICS lounge.
And I'm Benoit Peyronnet from France, working in Rennes University, a urologist with special interest in functional urology.
So, Benoit, by the way, we all know that you're dedicating yourself to robotics, to minimally invasive treatments. Thinking about people that didn't have the chance to attend the ICS 2024 in Madrid, what do you think are the key messages and the highest points that have been discussed on day 3 and throughout the Congress over the 3 days?
So, I really like the points that you brought up, the lecture from Ferdinando Fusco. I know his work very well, and he has worked for quite a long time on this idea of bladder outlet obstructions that can end up creating detrusor underactivity, and I think his lecture was emphasizing this important point, which is we need to be able to identify those high-risk patients that will move quite quickly to detrusor underactivity, maybe to be more aggressive in the way we treat bladder outlet obstruction in this particular population. So that's something that I love, especially from today, more globally at the Congress. As you mentioned, I mean, I'm really biased, but I'm a huge fan of minimally invasive surgery, robotics, and I was really glad I attended many sessions, like surgical video session. We did a workshop on robotics in general, and I see the interest is growing. People are embracing this more and more, and we've seen very interesting techniques such as like fascial lata sacrocolpopexy, female AUS obviously, but many techniques revisiting the older non-synthetic solution for female SUI, but with the asset, I would say, of minimally invasive surgery, laparoscopic, robotics. That's something that I love very much. And if I had to bring up a final, like another thing that I love, again, I'm very biased because I love artificial sphincter a lot, but I really like the fact that we had the chance to witness the presentation of the first in-human electromechanical artificial sphincter implantation, and also more data on the Victo system. So this idea of adjusting pressure in the artificial sphincters in general, this is something that is growing, improving, and I think that's one of the things that I will bring back home with me.
It's very interesting. Is the Victo system available in France nowadays?
Yes, as far as I know, not that many people are using it.
Yes.
But I guess, yeah, it's expanding worldwide. I know South America, some part of Europe. I guess, is it available in India?
No, I'm not aware. I don't think so.
But it's expanding, I guess.
Fortunately, in the near future, we have more high-level evidence to support the newer devices such as this one. And I see with a good feeling that we have newer technologies nowadays. And by the way, Sanjay, we know that we've been dedicating yourself to neurourology and the treatment of patients with urinary tract symptoms for a long time. You're a member and you'll be chairing the ICS Neurourology Promotion Committee, and we would like to know what are the highlights on neurourology that you had a chance to attend, to present, to be part of during the ICS 2024?
So in fact, I would like to focus not just on the neurourology, but a couple of things that I feel related to evaluation and risk stratification of management of patients. And these are not neurogenic patients, but I'm talking actually the non-neurogenic population. And the first is regarding, we know that lower tract symptoms in the adult population can in many individuals be traced back to some events that might have happened in their life earlier. So, let's say you look at overactive bladder. We say that overactive bladder is an idiopathic condition, but in many ways you can phenotype overactive bladder patients into subcategories of patients. And we know there are patients who have got affect disorders like anxiety and depression, which is behind some of their symptoms. We know there are some patients who've had adverse childhood experiences or even sexual trauma in their childhood. And we don't really have good methods in our clinical practice to decide which patients we should screen for these conditions, what screening tools we should use, who should screen these patients. Should it be the urologist, or should we be involving somebody else from our department, from other departments? And so there are a whole lot of unanswered questions, and throwing these patients into one basket of idiopathic functional disorders, I think, is not perhaps the right way forward. And it's quite possible that addressing some of these other challenges might show us that not all of these conditions are untreatable, or let's say are chronic conditions which never resolve. It's quite possible there's something behind some of them and which needs to be addressed.
By the way, one of the hot topics is how to individualize the treatment for patients with OAB. And some of the discussions were around the latest update of the AUA guidelines, which brings us some insights about how to jump from one therapeutic line to the other one, like bringing into account the perspectives and the preferences of the own patient.
Absolutely.
So some of the patients may be not willing to take medicines, and perhaps you can go straight to advanced treatments. And
Absolutely.
This is something that in a perfect world in which we don't have to consider like cost effectiveness shows to be very interesting. But I wanted to know your thoughts about that. How do you do in terms of how to manage these patients in India?
So as of now, in terms of the things that I discussed with you, we completely rely on our clinical judgment when the patient walks in. But the thing is, as urologists, we are not trained to pick up these conditions. There are also some patients and families who might get offended. So if let's say an 18-year-old or a 15-year-old girl comes with overactive bladder symptoms with her parents, and if I try and find out is there a background of sexual trauma in this patient, it might be offensive to the family if I ask that question. And knowing that many times such trauma actually is inflicted by either extended family members, relatives, friends, it's even more important actually to be able to elicit that information if it is there. So I think we don't have the perfect solution. We're relying right now on our experience as clinicians, and we try and communicate that to people who train with us, etc. But really, I don't think we have a good protocol for these patients. The other interesting thing that I attended today was, and I think all of you who have not attended this year must attend next year, is a case-based discussion that we had on the application of urodynamics to both male and female lower tract symptoms. And that, I think, was an excellent discussion. We had 4 cases which were discussed, 2 men and 2 women, and utilizing urodynamics in the right manner to decide which patients not to operate, or when to not go for more invasive therapies, and when to choosing the appropriate management. So I think that was an interesting session that I think is very useful for people.
So I would like to thank you both for your availability to record this interview, and I'm sure that our colleagues all around the world will enjoy a lot listening to your insights concerning the hot topics that have been addressed during the ICS 2024, and we are certainly looking forward to the ICS 2025.
Absolutely.
And I hope that we can see each other very soon. So don't miss the opportunity to watch the next videos that are being added by the ICS office on the online channels. And Sanjay has a final message to
I have a final message because we can reach many of you through this. I just want to bring to your attention the ICS Best Review in Neurourology Award, which the Neurourology Promotion Committee we have initiated this year, and we already have the first recipient this year. Early career members can send in their review before 31st of March 2025, and if their review is chosen, then they get not just a certificate at Abu Dhabi ICS, but they will get a free registration for Abu Dhabi ICS. So I would encourage all of you to send in your reviews for the Best Review in Neurourology Award 2025.
Another unmissable opportunity. So all the best, and see you in the next videos.
Bye.